Can you walk us through your thought process or diagnostic approach when you encounter probably an incomplete tooth fracture?
Incomplete root fractures?
Tooth fracture, yeah.
See, any case, I have a very standard protocol. I have every case, I'll tell you my general approach. So I do only endodontic work. I stopped doing general dentistry work. So I get referrals, I'll go through the whole sequence. I get a letter from the patient, patient's called in for a consultation. I book a 30-minute appointment for a consultation. Clinical examination is done. 15 minutes it takes. I take intraoral pictures. I take my radiographs. And then if the patient needs a CBCT, I do it. The next 15 minutes is the consent, where I go through what's got to be done, what's not got to be done, processes, everything is just discussed in detail. Now, root fractures, incomplete root fractures, you've got to see where the fracture is. Now, you see, the question you need to ask is, what is the strategic value of the tooth? What is the age of the patient? How much does a patient motivated to keep that tooth? Now, as a generic rule, whether it is whichever part of the tooth, whether it's a tooth with a poor prognosis, moderate prognosis, good prognosis, this is the bottom line which I go through. How much does the patient value that tooth? And then you basically classify the probability of success based on, I put it either as percentages or I give it as a prognosis of good, fair, hopeless. The patient is explained, you put it on your clinical records and sign the consent form. Now, every case is different. It's impossible. Cracks are something, cracks and fractures, we see it day in and day out. Maxillary 4s and 5s and lower 7s. Everybody has got cracks, it just doesn't get diagnosed. But it's ultimately the discussion between the patient and the dentist which is important. We know the treatment modalities. Treatment modalities, I don't do anything different. It's exactly the same. It's exactly the same. But it's just the approach which is different. Sorry. Anyone else?
Thank you, sir. Any questions? Any questions from the audience?
So in your presentation, you told if you can't able to, put a rubber dam, you're not going to do a root canal treatment. Is there any pre-endodontic restoration you think about, or you decide you must not do a root canal for those cases?
So, if you can't get a dam into a tooth, there are two reasons for it. One is, there is not enough tooth structure. If there is not enough tooth structure, you need to ask yourself the question, is the tooth actually restorable? If the tooth is restorable, the dam has to go in place. Challenges you do get. You do get patients, maxillary 7s, we get them. Huge, big fat patients with a huge buccinator, just can't get the dam in. You've got ways around it. You've got ways around it. Usually on an upper 7, I use a winged clamp as a single step technique. There are cases, the exception to this rule is patients with trauma. You get patients where they have decoronation. You get this, maxillary premolars, you get these patients where you do a crown, and you would have seen these patients, they bite, the crown has come out with the entire coronal tooth structure. So you need to do an endo, and then you're planning to do a post and core. So what do? My simple way is, first appointment before I get into the tooth, if I think the tooth is restorable and I'm going to struggle with the dam, I build the tooth up with a composite. I make sure the buccal and the palatal wall has got a composite restoration before I put the dam in. If it's done, and if you extend it over the surfaces, the dam will stay. If you don't extend it properly, the problem is you put the dam in place and the patient just moves his cheek, pop, it'll pop out. That's the problem. Challenges, yes, you do get cases, but always as a general rule, excavate the caries, build up the wall completely, either with a glass ionomer as an intermediate restoration, or I build it up with a composite, and then do the axis. If you do the axis first and then start building it up, it's very messy. Always clean the cavity, put a restoration, and then cut through it. It's always 100 times easier.
Thank you, sir.
If you have any questions, I'm happy to help. Whatever little knowledge I have, I'm happy to share. Thank you.
Thank you, sir. Dr. Anand, sir.